I think people are looking at their national situation and they're looking at the global media and they're saying, well, hang on, it's different here to there, and these people are opening up over there, and we've still got tons of cases over here, and why are they opening, we're not opening? So there is some confusion out there. Maybe this should be the same everywhere, but it's not. This whole pandemic, each country, each region has had a different experience, and the impact, the point of impact of the pandemic has shifted between countries and between regions. But if you look at the overall global situation, and Maria is absolutely right, 75,000 deaths last week. At the peak of this pandemic, at the highest week ever in this pandemic, was around 110,000 deaths. And that was considered to be the most awful week in the pandemic. We're at 75,000. It's not a whole long way from there. So there are still many people dying from this disease. I think another important observation is that in 5 of the 6 WHO regions, the percentage of the deaths increased in the last week. And in 2, in the Western Pacific and in the Eastern Mediterranean, there were a 27% increase and 38% increase in deaths respectively, and 14% in Africa. And it's, to me, that's occurring at the same time that the number of reported positive cases has dropped. So we're seeing the number of cases appearing to fall away, and yet the number of deaths is increasing. And when you see that trend epidemiologically, you then ask yourself the question, is that real? How could the deaths be going up and the number of cases is coming down? Now, it could be that the deaths we're seeing now are a lag from a few weeks ago, and that's one explanation. The other explanation is that testing rates have dropped off remarkably in many countries. So countries who are claiming now to say our transmission has dropped and we've got 2 to 3-fold less cases this week than we had 6 weeks ago, go and look at the testing rates and you see that the testing rates are much lower. So as society opens up and as people are able to go back to their normal lives, there's people are less instinctively going to go and get tested. It's not, in some cases, not even a requirement. So I do think we have to be very careful in interpreting the data. And I would say that right now we're in a period of great uncertainty. The pandemic is by no means over. Countries are having to make decisions, to try and normalize and bring society and economies back online. And there's a tremendous political and social pressure to do that. And I completely understand that pressure. But we also have to be very careful. As Maria said, over 74,000 cases are deaths in the last week. And we're seeing those death rates increasing. And that's not because there's a brand new variant. That's because Omicron has taken over and everyone said, well, Omicron is much milder. But the reality is, I think, even in the United States, it's historically the highest number of people dying. So I think we're going to go through another number of weeks, months of uncertainty here, and I think we need to be very careful about the potential emergence of new variants, while at the same time dealing with the reality that the number of cases and the transmissibility of Omicron and the potential higher transmissibility of the BA2 variant means that there will be potentially other surges of cases. And I think we're seeing that, Maria, in some countries, getting a surge of BA2 related cases now in the aftermath as it takes over from the BA1 lineage. They're both Omicron. And again, you're seeing that competition. You're seeing the viruses. It's the Olympics for the viruses right now in terms of each sublineage, each subvariant, each variant trying to outdo the next one. And that process will continue. And as long as transmission continues, that selective pressure will be on the virus. Right now still, if you're an older person or you're a person with an underlying condition, the single best investment you can make right now today is to get vaccinated, because the chances of being admitted to hospital, being admitted to ICU or dying are vastly greater in people who are unvaccinated. And the data is coming out from every country now. It's coming, and it's absolutely consistent. The most important thing you can do to save your own life or the life of somebody else is to get vaccinated. And equally, as Maria said, we need to remain cautious, because even though I may be vaccinated and I may not have a risk factor or I may not be under an age, I may have a loved one in my family who is, and I don't really want to bring that virus there. So avoiding infection as best we can, and at the same time getting vaccinated. So again, it's a big discussion right now, and I see more and more articles about hesitancy and this issue of mandates. And you know, I've said that consistently, I hope, since the beginning. This is about continuing to engage with people, to persuade, to convince, to show people the value of vaccination, not to harangue people, force people, push people. And I don't want, and I've seen some stuff in the media othering people who don't want to be vaccinated, saying that they're, you know, they're weird or there's something wrong with these people who don't want to be vaccinated. I don't believe that to be the case. I think it's really important that we don't have the vaccinated against the unvaccinated or vice versa. And I see with some of the demonstrations and stuff that's on, it's become political again, it's become very nasty again, it's become very ideologic again, and that's not going to get us anywhere. It's really not going to get us anywhere. We have got to be able to demonstrate and continue to show people what the benefits of vaccination are, and be prepared to have those long conversations and listen to the concerns that people have around getting vaccinated, and understand that hesitancy doesn't come from a bad place. Hesitancy comes from an unsure place, and therefore reassuring people and giving them the right information. And I know it sounds hard. If you're someone who's been vaccinated and you have a friend who hasn't, talk to that friend. Mm-hmm. Don't turn this into, I'm the good person who got vaccinated and you're the bad person who didn't, because I don't think that helps. I don't think it advances us in our agenda to make sure that everyone in society is protected. And again, I'm seeing, you know, low uptake of vaccination in so many places. And I think that's our greatest barrier to actually getting out of this pandemic right now. Mm-hmm. And we're still not making it in many countries. Even though vaccine availability is increasing, and in many countries, vaccine is available anytime you want it, in multiple places, walk in, and yet people aren't doing that. And we need to continue the conversation, Alex, and we need people out there in social media, we need influencers, this is not going to be the job for the doctors telling everyone what to do or governments. This is about society deciding and internalising the benefit of vaccination for everyone, and then having a proper, respectful conversation with our friends and families to give people the information they need, and try and bring as many people as possible with us to be vaccinated.
Thank you both. We have a lot of follow-up questions. So maybe I'll start with this one. Mike, you mentioned that there is less testing happening around the world at the moment, and that's why we are seeing decrease in reporting cases. So Angelina Ware, watching us on Facebook, is asking, oh, sorry, this is not a question from Angelina. It's a different question that I will pass later. There's a lot coming here. However, the question is from Chelsea: are self-tests at home impacting the numbers of cases being reported officially?
I think it can. I think, first of all, the ability to do self-testing can be extremely useful. It can be a really good addition to your attempt to keep yourself safe. For example, I've seen many colleagues self-testing themselves before they go to see an elderly relative, and just trying to make sure that even though they're double vaccinated and even though they're not sick, they take an antigen test before they go to do that. Being able to, if you just have a sniffle and you're double vaccinated and you think, oh, I wonder, do I have COVID? Doing an antigen test means, you know, you're not going to walk into work and then get a PCR test and find that you now have 10 contacts. So that's really useful, and empowering people to be able to do that is very positive. The challenge with antigen testing is that it needs to be more available everywhere, and it's relatively expensive. And when countries are faced with in constrained economic environments, when they're faced with a choice between making sure their hospitals have enough oxygen or handing out antigen tests, sometimes it becomes a trade-off between the different things you can do within a very limited budget. And therefore there is an inequity in the distribution of these antigen tests at community level. I really do support, certainly in many countries, beginning to use antigen tests within the clinical environment as a pre-screening, so that when someone sees someone, they can do an antigen test and then refer them for a PCR test. And that can make things very fast. It can also mean that the person knows they're positive before the PCR test, and in that day that it takes the PCR test may reduce exposure of other people. So I do think we need much more antigen testing in the health system as people access the system. And then when you do have antigen tests coming before the PCR test, you may see the number of PCR tests dropping because you're not testing as many people. But what we're seeing is that the number of positive cases is rising exponentially in some countries, and that's not necessarily linked to people doing more antigen testing. There is a downside on antigen testing in that people could do an antigen test to avoid having a PCR test and don't act on that information properly. And it's still very, very important, and I see countries are considering over the next weeks and months in lifting the requirement for isolation if you're a case. If you're an antigen positive person, if you do a test and you're antigen positive, you are very likely to be a positive case. And the PCR test is really just a confirmation, and the antigen, and actually more so. Yeah. In fact, if you're antigen positive, you're very likely to be infectious, and therefore you need to self-isolate. And I do think when we talk about lifting restrictions and changing the public health measures, the one measure at this moment that I think is we really should not be thinking of changing right now is the requirement to isolate if you're antigen or PCR positive, because that means you're infectious. You are going to transmit to other people if you're not self-isolating. So I do think that's an important consideration. But I think an antigen test that costs $1 a piece, that may sound very cheap, and in the industrialized world, that's a small little expense to buy a few antigen tests. But if you're living in a developing country where you might spend $5 or $10 per person on health for the whole year, 5 antigen tests or 10 antigen tests are massively expensive in the context of how much money people spend on health. So we have to be very careful when we talk about cheap antigen tests. Who's cheap? Cheap in Europe is not the same as a cheap available test in Africa, and therefore we have to work harder. And I know, Maria, you and the group working within the ACT Accelerator are working to increase access to antigen tests. And even we talk about us here in WHO, we're not wearing masks here because we're suitably distanced, but every other place in the building we're still wearing masks. We still have a reduced number of people in the building, and a requirement for vaccination to enter and work in the building. We had to make special arrangements during the executive board a couple of weeks ago with extra testing for everyone, including ourselves, because we had guests coming to our house, in a sense, to the WHO house. So this is about taking appropriate, adequate measures, looking at each risk. The risk changes in this building from day to day because it changes depending on how many people are in the building. So we increase and decrease our level of vigilance depending on the risks that we perceive. And that's all you can do in anyone. It's the same in a household. It's the same in a workplace. It's the same in a hospital. So that ability to be able to continue to reduce the risk of transmission in these settings, and even when everybody comes back to work, and I think this is something that everyone goes back to social life, we're going to have to look at what might have to be, at least for the foreseeable future, some sustained personal behaviours. So, for example, as countries lift a requirement for something, they're replacing that requirement with public health guidance. So they're saying it's no longer required to make a mask, but our guidance would suggest that you should wear a mask on public transport. Now, I would ask you, in that sense, it's very contextual. Like the rules of the road say you should drive at 50 kilometres inside the city limits. That's a general rule. That's an important rule. And if you exceed that, you break the rules. But if there are people crossing over the street on some kind of a party or a march, you don't say, I'm now allowed to drive at 50 kilometres down the street. You reduce your speed because you can see the local risk has increased. The risk of something bad happening has increased. And I think it's the same when it comes to these issues. I think for the foreseeable future, certainly in my own case, if I'm going to be in the workplace setting or whatever, I'm very comfortable to continue wearing a mask in order to protect myself and protect others. But I'm also recognizing we have to have meetings and we have to do the things we have to do and we have to travel. I'm traveling tomorrow. I'm going to a conference. That wouldn't have happened 6 months ago. But I just came back with my PCR test before I travel and be masked all the way and have your vaccination cert. So that's the idea, that each and every person needs to say, look, I really don't want to get infected because I don't want to be sick myself. I don't want the risk of dying. I don't want to infect somebody else. I don't want to get long COVID. So how can I reduce those risks? Even if the government says it's not mandatory anymore, how can I continue to, as Maria said it, wear a mask in certain settings, ensure there's good ventilation inside, avoid going into massively crowded environments where you know the local transmission is occurring, managing ventilation inside in a way that allows you to disperse aerosols. To me, that's just about being smart. In the same way you're smart when you drive on the road. You're not just driving by the rules, you're driving by what you see. And you adjust your behaviour on the road to be safe for yourself, your family that you're carrying, and other people on the road. It's being courteous and being safe. And that doesn't require one to say, well, the rules say this, therefore I'm allowed to do everything up to the rules. That's not the way we live our lives. We live our lives by actually respecting the rules, but then looking at our individual situation and then trying to adapt and reduce our risks to something we can manage ourselves and we feel comfortable with. And we do recognise this desire to open up, this desire to go back to normal. But if that desire to go back to complete normal in that sense is going to sustain this pandemic going forward for much longer than it needs to be, then we have to, we really need to think about that. And I do think that some situations, the political pressure now to open up and remove all restrictions of all kinds is so high that we may overshoot the runway and we may end up in a situation where, and again, I'm acknowledging uncertainty. I'm not sure that will happen. I'm not predicting that will happen. But I'm a bit nervous right now that we're sort of just lifting everything and and if we get hit with another variant, and we've already sort of abandoned all measures, it's going to be really hard to put anything back in place. So I would just, as Maria has said, ask every individual just to look at your situation, reduce your risk of being infected, reduce your chance of infecting someone else, be smart, protect yourself, protect others, get vaccinated, and just be safe and be careful. And if we all do that, if everyone does that a little bit, then the overall risks decrease. But this idea that we're just going to abandon everything, I think is a very premature concept in many countries right now.
Thank you, Mike. Actually, this was the next question I wanted to pass on you, because several of our viewers sent similar question about lifting measures, sharing their anxiety about it given the epidemiological situation, and some of them are asking what is WHO doing in this situation, as we're seeing what's the situation, but we also see countries lifting measures. So how are we doing to support them or to support people to do the right thing?
It's kind of the way we came into it too. We've never, as WHO, ever advocated for these swinging measures and massive lockdowns. We've always talked about calibrated, adapted measures to the situation we're in, and using the minimum measures necessary to do the maximum suppression of the disease. And as we went into this pandemic and through this pandemic, we've always advised that those measures be adapted to the situation. And we've seen countries do very well, particularly in the Western Pacific and in Asia, being able to raise the level of measures sequentially and then reduce them sequentially. So we're not saying that countries don't have a right to begin reducing measures. What we'd like to see is a step-by-step approach, a calibrated approach that still looks at the data, looks at the epidemiology, looks at how the health system is doing, and then slowly comes down the mountain, step by step. I said this way back, I think a year and a half ago. You're much likely to fall when you're running down a mountain than when you're trying to climb it. And the problem is everyone's trying to run down the mountain. And the danger with that is you can fall. That's where we're not saying, and I would hate people go away from this conversation or other conversations and say, oh, WHO, why are you saying this? You're scaring everyone. And this is just all about keeping the focus on the pandemic. And I heard someone said to me the other day, it's because you people in health and the doctors and WHO just want to control the world, and this is your big thing and you're going to hang on to this as some means. I want this thing to go away so bad, right? And I mean so bad, right? I mean, I've seen my kids 5 times in 2 years, you know. I don't see my family because they live in another country. Many of us in the UN system, we live away from our home countries. We've been deeply affected by this. We've seen our friends sick. We've seen our friends die. We've seen and experienced that with the world, and we watch those numbers every day, and the horror of those numbers some days was almost too much to bear. So we want this to go away, and we want to go back to being normal, but we have to be just careful, step by step. And it's not to criticize countries who are trying to step away. There are many countries taking a very measured approach, and they're trying to do it step by step, balancing the risk of the disease against the economic and social damage that restrictions do. Finding that balance is not easy, and if it was easy, then it would be all done and we'd be fine. It's not easy. It's influenced by so many factors. So I'm not here to criticize countries who are trying. I'm just here to say, just ripping this restrictions away without any other plan, to me seems at the moment, in the current uncertainty we face, just to be ill-advised, and we need to think it through. And and even if governments do that, Maria said it, individuals then need to take their own action to protect themselves, protect their families, and ensure that they stay safe.
Here's a question from Julianne. Won't there always be variants? So what's the way forward?
There will be variants, and that's the issue with these coronaviruses in general. Coronavirus are a whole family, and they exist in many different forms. This particular one, SARS-CoV-2, has many variations, and it will continue to evolve. That's the way of viruses. The viruses, well, you know, the microbes may be around for a lot longer than we are as a species. They're supremely adapted to survive, and they will continue to do that. And both myself and Maria have said this from many, many months, more than a year now, that the virus won't disappear. That opportunity is not there. What we're trying to end here is the public health emergency associated with that virus, and getting to a point where enough people are protected by full vaccination, where we have strong clinical management, as Maria said, point-of-care diagnostics, where someone going to the family physician with a cough or a fever can be diagnosed on the spot with for COVID-19 or flu, because we're developing diagnostic tests that can distinguish between the two. That person, if they're over 65 or if they have an underlying condition, could immediately, regardless of vaccination history, be placed on antivirals. So you can get to a point where this becomes a normal thing. Before the 1940s, if you got a pneumonia or you got a bad wound infection, you died. Mm-hmm. And millions of people died. My great grandfather died of blood poisoning from cutting himself shaving, and he got a bacterial infection of his blood and he died. A young man, I think he was in his 30s. That would have been a quick trip to the GP and an oral antibiotic. So the difference between the bugs didn't change in the 50 years. What changed was the intervention. So we now have diseases that would have killed us 50, 60 years ago, but we have vaccines to prevent them, we have drugs to treat them, we have measures to prevent them. And I think that's where we need to think about, not let's get rid of the virus, let's get to a place where we have the vaccines and we have the treatments and we have the means to normalize this, turn this into any other pathogen, turn this into just another bug that we can manage and we can deal with. Within that, we have an opportunity, and we had a huge meeting a couple of weeks ago under the Research and Development Blueprint for Epidemics, looking at vaccines that would cover a broad range of coronaviruses and SARS viruses and beyond. So we may get to a point where we can get vaccines that will cover a wide range of variants, a wide range of SARS-CoV viruses, and a wider range of coronaviruses in general. And we may get to a point where we get broad spectrum antivirals that work against multiple viruses. That's down the line, but it's something we need to be looking at for the future. But right now we have the means to bring this disease to a position where we have it under control in terms of the damage it does in our society, to our loved ones, to our economy, to our healthcare system. And we have the means to deliver on that. We have the vaccines. I mean, this is the issue. We have the vaccines. We now have antivirals. We have diagnostics. When in the past, it took years in HIV to develop the antivirals, to develop the diagnostic test at point of care. I mean, it's a huge triumph. The HIV community are pathfinders in the world around integrating diagnostics and clinical care at the primary healthcare level and bringing justice and equity. It took years, and it took a massive fight on behalf of that community to get that justice. We're still behind the curve with the equity, but we're faster than we were the last time. I'm not saying that's success, it's not. But we are getting to the point where we have those vaccines going out all over the world. We have that ability to bring diagnostics everywhere. We have the ability, if we're smart, to bring the antivirals everywhere, but we have to use them smartly. We need to make sure the antivirals go to those who most need them. So this is about putting a system in place in which we all feel safe again. And I actually think we have the tools to do that. We have. It's just about implementing them in a systematic way. And not looking for that on-off button, as you said, not saying it's on, it's off, it's pandemic, it's not. These ideas of have really, these false dichotomies have killed us in this pandemic. Ideologic sort of dichotomous things, and I do think we have more than we think we have, and people should not lose heart. We're not saying here just because the cases are high or we're getting variants that it's terrible, it's just like it was a year and a half ago. It's not. We have so much more. Science has triumphed, developed vaccines, antivirals, diagnostics. We know this virus better probably than any virus in history. There's been more research done on this virus than probably any virus in history. We've clearly demonstrated that the human intellect and human ingenuity can triumph. But what we haven't done is delivered those interventions properly. Either through lack of equity in their development and distribution, or through the hesitancy we see in people wanting to use those interventions. So we still have a ways to go. So I do see us getting out of this. I do see variants will continue to emerge. But we need to reach a point where ordinary people can get on with their lives. And they need to then think, yes, scientists and the doctors and the health system, we've got this. We've got the drugs, we've got the vaccines, and we can get back to our normal lives. But we may have to sustain a higher level of vigilance for longer than we expected. So we may have to wear masks in certain situations for longer than we expected. We may have to keep the windows open for longer than we expected. And we may need to invest in the longer term in looking to the future and say, when the next pandemic occurs, are we going to be in a position to do these things quicker? Are we going to make sure that our indoor spaces are better ventilated as a rule? Are we going to have the ability to distribute masks instantly in a respiratory virus event? Are we going to be able to deliver protective equipment to health workers more quickly? So there's an awful lot we can fix in advance of any further event, and there's a lot we can fix before this one ends.
Lee Kumar is asking or saying the first and the second or third vaccine composition, or I mean the doses, I believe that's the thinking, is the same. Does it really help to repeat this type of vaccine? And also there are a few questions about any plans to change the composition of the vaccine. We're having research and development forum next week, so I thought maybe you can answer this question.
Well, I'll pass that second bit to Maria, because she would have attended the TAG-COVAC meeting, I think, today or yesterday? Today. So we have a special advisory group that's looking at vaccine composition for the future, so Maria can speak to that. But in terms of the value of vaccination, in terms of having a booster or a third primary shot, there is a lot of evidence to suggest, and we've seen the same with people who've had a natural infection followed by vaccination, that you do get a boost in your antibody levels after you get another shot, but there's probably a limited value to how many times you do that and get a benefit. Just the level of antibodies doesn't necessarily indicate how much protection you have. But what often happens, though, and the benefit that may come from extending the course, for example, in an older person who may be immunocompromised with underlying conditions, they may not generate a fully mature immune response after first and second dose. And it's not that their immunity wanes per se, it's that their immunity never develops to the level it should have been in the first place. So in a sense, when they get a third dose, it's not like a booster, it's almost like a third primary dose. They needed 3 doses to get to the same level as a 22-year-old gets to with 2 doses. What very often happens too within the immune system is and I don't want to go into all of the details here, we'll bore people to death, but the immune response matures. Maybe it's like a good a good wine or whatever it may be. But there's a process that over time and with re-stimulation, either by natural infection or by another vaccine, the immune system doesn't just generate more antibodies, it actually matures in the response. And you get these longer term, it's like the difference between short-term memory and long-term memory. You start to generate longer-term memory and a more mature long-term memory for that virus in the system. Because what the system is essentially doing is thinking, hang on, because in some sense your immune system doesn't know whether you've been infected by the virus or whether the vaccine. It's reacting to the presence of that antigen in your body. And what the immune system is probably doing is there's hundreds of millions of pathogens out there, but it tends to prioritize the ones that keep showing up. So in effect, when you get your first dose and your second dose, or maybe your third dose, your immune system starts to say, in a sense, say, hang on, this thing has come back a few times now, I need a more long-term, mature ability to detect this type of virus every time and quickly. And you end up getting a much better cell-mediated T-cell response that gives you a longer and sort of broader protection against that virus and possibly a wider range of variants that may emerge as well. So it's a maturation thing. So there is a benefit, but then there's a point at which you get probably no benefit from that at all. At the moment, if you're an otherwise healthy person and you've had 2 doses of an effective vaccine, you are, as Maria said, very well protected against severe disease, hospitalization or death. If you're an older person or someone with an underlying condition, the data clearly shows that there is a benefit to having that third dose if it's a 2-dose vaccine, and that booster gives you that kind of restores your immunity or boosts your immunity to a point where it's adequate. So that there is a value in having that. But our main objective in WHO is to get everyone in the world to that 70% to be 2-dose fully vaccinated. We have the prospect and we have the work ongoing, looking, and we have a whole scientific group looking at the issue of broader spectrum, 2nd and 3rd generation vaccines that will provide broader protection and longer protection. We've groups looking at nasal vaccines that could be actually give you immunity on the linings of the respiratory system, which would actually prevent the virus getting in the first place. And that has certain advantages. We see that with everyone out there has had an oral polio vaccine. But everyone out there has probably had an injected vaccine as well, and you say, well, why do we have an oral vaccine and why do we have an injectable vaccine? Well, we have because those 2 vaccines do different things. When you take an oral polio vaccine, you get the immunity in your gut that prevents the virus coming in and being further excreted by you. In the same way, if we had potential nasal vaccines, they may prevent us getting infected in the first place and then generating virus in our noses, in our upper respiratory pathways or lower respiratory pathways, and then coughing or sneezing or contaminating others. So there's a huge prospect for us to take that to the next level. But I think going back to your point, Maria, there's very clear evidence that that getting that primary course, that 2 doses of vaccine, and then in certain cases that 3rd dose as a booster in certain individuals does give very high levels of protection. Well, that will be for our number one, that'll be for our member states to decide what's in that. And what's great is our member states have agreed to take that forward. They've agreed to create a negotiating body to do that. It will take time. And a treaty is not a solution. We've seen this with climate. Just having a treaty doesn't mean you're going to be successful. But I think 2 things, Alex. One is a treaty is about everybody. Pandemics are not like other things. Pandemics is more like climate change. It affects everyone on the planet. We've seen it. It's a risk and a threat to everyone on the planet. Therefore, everyone has a stake. And it doesn't matter if you're from the Cook Islands, Croatia, Canada, Chile, or China. The reality is each country has a stake. because each country has a population. We've seen the devastation in the small island developing states, the economic devastation that this pandemic has brought. So even though they weren't hugely affected necessarily by the virus, their economies were destroyed by all the restrictions and the loss of tourism. So everyone has suffered, and everyone then has a stake in defining the solution. What a treaty will do is allow all member states, all countries to come together and set out a new framework, a new agreement, a new pact that says, how are we going to make sure this doesn't happen again? How are we going to make sure we have the right surveillance systems, the right data, the right investigations, the right research and development, the right workforce, the right supplies, so that the next time around we don't lose that memory of what we've gone through now. And my experience has been over 30 years in international public health, is that's what happens. You immediately get amnesia. After SARS in 2003, I thought the world is really going to take this seriously now. It's got a big scare, and the world is really going to now take seriously the idea of pandemics. It didn't happen, and in 2009 we had a pandemic again. I think the treaty will allow that level of discussion, and that means political commitment. And in some sense, I said it many months ago, it's almost a promise to our children and our children's children. We've gone through this pandemic. Everyone has tried hard. Everyone has worked hard to try and reduce it, and we've all made mistakes. But what we have done is learn precious lessons at a huge cost. Now we have a responsibility to make sure those lessons are not lost, and that they're enshrined in a way of doing business for the future that's more equitable, that's more about sharing, more about fairness, more about a collective response, and recognizing that a pandemic is a collective threat to everyone. That requires a collective preparation and a collective response. And I think the treaty will give us a chance to do that. But a set of words written down on a piece of paper isn't going to change anything unless we can build the systems and the tools and the communities of practice, and we can build the information systems and build the workforce and build the supplies and all those other things around that. So I have huge hope that the states around the world, that the nations of the world can come together and agree. But I'm not so naive that I think just writing things down on a piece of paper means anything unless we're prepared to actually implement it.